Hi there, Jonah here. I'm an Air Force medic. I'll be demonstrating the proper application of the Junctional Emergency Treatment Tool or JETT tourniquet. It is designed for use on life-threatening bleeding from an inguinal wound not amenable to a limb tourniquet and is performed during the tactical field care phase. The Committee on Tactical Combat Casualty Care recommended junctional tourniquets should be applied after proper wound packing of any open wounds. Consider body substance isolation. If a combat lifesaver is available, direct them to assist.
Expose the injury and assess the bleeding source. Clothing may need to be cut away to properly expose the injury. If possible, apply direct pressure to the source of the most active bleeding. Empty the casualty's pockets and remove items such as equipment and weapons from around the hip area. Place the casualty in a supine position. Continue to apply direct pressure over the femoral pulse just below the inguinal ligament while preparing the junctional tourniquet. Open and unroll the device and prepare for application. Ensure the label that says "this side toward casualty" is facing up and toward the casualty. Next, slide the belt under the small of the casualty's back or buttocks, or pass the belt behind the thighs. Now, locate the femoral pulse just below the inguinal ligament, running from the superior iliac crest to the pubic bone to guide the proper placement of the device. Using a back and forth motion, slide the belt under the buttocks so that the pad is centered behind the casualty, allowing alignment of the pressure pads just below the inguinal ligament. Adjust the two junctional pressure pads on the straps to position them in the area over the femoral pulse just below the inguinal ligament. Now, angle the junctional pressure pads so that their long axis is lined up with or parallel to the inguinal ligament or gutter. The distal part of the pad will be pointed somewhat medially at approximately a 30-degree angle, ensuring the casualty's genitals are clear of the area to be compressed. Slide the female end into the male end of the buckle. You should hear an audible click. Firmly pull the free running end of the strap with the loop handle to tighten up the device and remove all slack. Stabilize the belt with your other hand while tightening. Reassess the pad placement to ensure the pressure pads are correctly positioned over the femoral pulse and below and parallel up to 30-degree angle to the inguinal ligament. Tighten the threaded T-handle on the injured side by turning it in a clockwise direction while using your other hand to stabilize the base plate until the bleeding has stopped. If the extremity is intact, check to confirm that distal pulse has been occluded. Now, insert the toggle into the opening on the threaded handle and cinch it tight at the base plate to secure the device. Repeat the same procedure on the other side if bilateral junctional injuries are present. You should monitor the casualty often during movement and transport to ensure the device remains properly positioned, and adjust the device as needed to maintain hemorrhage control. Document the time of application on the designated space on the loop handle. Document all findings and treatments on a DD Form 1380 TC3 casualty card and attach it to the casualty.